Good afternoon. My name is Pam Fair. I'm the Macmillan Prostate Cancer Nurse Specialist at Northampton General, dealing with patients who have stable prostate cancer. Also on the line today, we have got Maggie and Caroline from Kettering, who both are responsible for remote monitoring over there. The session on remote monitoring is really just so that you are aware what it entails. If we are putting you onto remote monitoring, you need to know what it is about. So what is remote monitoring? What remote monitoring really is a way for us to just keep an eye on what is going on with your prostate cancer without us needing to do the face-to-face or telephone follow-ups that you will have been having for some time. You may have been having your follow-ups with the consultant, or you may have been part of the stable prostate cancer follow-up. And if you're at Kettering, you've probably had your appointments in the past with Janine, probably with Caroline, and also maybe with Maggie over the telephone. So instead of having those appointments, we will be doing these distantly. So you won't actually get contact directly with a nurse. Once your treatment has been completed, the multidisciplinary team will decide who can have their surveillance done in this way. So the decision has been made as to what is the best way to continue to follow you up. So you have no need to come along to an appointment at all. You won't need to pay to park your car at the hospital for a 5-minute appointment where you're in and out, and you won't need to spend 20 minutes chatting away to us on the telephone. So what is self-supported management? It's quite important, if we suggest that we're going to put you onto this, that you actually know what it is. So it's really about you taking ownership of your prostate cancer and your follow-up appointments. It is all up to you. You need to know when to have your blood tests done, and predominantly it will be down to you to organise your blood tests. You won't be receiving a reminder letter at all for this. You need to know what to look out for. So you should have been told this at your last clinic appointment with the nurse specialist or the doctor before you move on. And it's also important that you know who to make contact with prior to you being referred back in if your GP was going to do this. So you should have been given the details in a form of a leaflet. There is a self-supported management leaflet that we use, and you should have that, so it will tell you what things to look out for and when to make contact with us, and have the telephone numbers to contact us, and also where to find support. So for the tests, as part of your routine surveillance, you need to have your PSA blood test taken at specific intervals. Now, the PSA blood test, just to remind you what it actually is, it is called prostatic specific antigen. It is not the be-all and end-all with your prostate cancer, but it's a good way of us knowing exactly what is going on with your prostate cancer once you've had a diagnosis and once you've had treatment. You normally would have your PSA blood test taken on a 6-monthly basis, or possibly if you've been diagnosed for an awful long time, you're having your PSA now done just on an annual basis. At the last appointment that you have had with your clinical nurse specialist, she will have told you when to have your PSA blood test done. And almost certainly you will have received a letter, and on that letter at the bottom, it will probably be written in bold. It will tell you the date or the month at which you need to have your PSA done. So if you've been followed up now in October, you'd probably be having your PSA done in April and October, and the letter will tell you those dates. So then it is up to you to get your PSA blood test done, because there will be no reminder letter to say. Once the PSA blood test has been taken, you would have received a letter from us as part of the remote monitoring programme. It comes from the Somerset Cancer Database, and the letter which is showing here now on your screen will have it highlighted as to the date that your PSA is next due to be taken. So we normally say within 2 weeks of that date, we would like your PSA blood test to be done. And the line above that will have the PSA blood test result for the test that you have just had taken. Right, so as I've already mentioned, the PSA is a blood test. It is a tumour marker. You've had it for some considerable time from when your prostate cancer was initially diagnosed. Generally, you will have your PSA blood test taken because you will have been given a form. Over in Northampton, if you have had your PSA requested, it may have been requested electronically on the ICE system, or you may have been given a blood form that's a blood chemistry form. It's got a green corner that says blood tests in the corner of it. And if you have your blood taken at Kettering or Wellingborough, your PSA blood test form will be given to you from Kettering and sent out to you from the nurses over there, I believe. Isn't that right? Thank you. It is the only way really we can see what your PSA is doing distantly or what your prostate cancer is doing. So if the PSA blood test for any reason is raised slightly, then we will let you know that, and you will have a different letter just to tell you that we need to repeat that blood test, and possibly we will be in touch with you over the telephone to tell you that you need to have an appointment. That may be with the nurse specialist, or it could be that we would arrange an appointment for you to be seen by the consultant. So it may well be nothing to worry about at all. It may be that your PSA blood test has gone up because you've had a bit of a urinary tract infection, in which case we're likely to also repeat a water sample for you just to check that all is well. If for any reason you don't have your PSA blood test done at the time we expect you to have it done, you would get a different letter that just says we were expecting to have your PSA blood test done perhaps at the beginning of October, and please will you go and have your PSA blood test taken, and there will be another form there for you to get it done. The things that we feel that it is very important to look out for once you're monitoring yourself, it's important for you to tell us if you have any of the following symptoms. So you can see now on your screen, it says difficulty in passing urine or worsening urinary symptoms. So the things that we're looking at there are that it is becoming more difficult to pee, perhaps because you've got a narrowing in your water pipe, and this is something that we know that can happen if you have had radiotherapy or surgery. So again, we would need to know that. If you are finding that you are going much more frequently, it could be because you have a urinary tract infection, and again, we would suggest that you do make contact with us about that. If you have what we call hematuria, which is blood in your urine, again, we need to know that that is happening to you so that we can look into this further. It may be that you will need some other investigations, or it may be that again it's related to a urinary tract infection, but you should let us know that that's happening. If you get any swelling in your legs, that again is another thing that is important that you let us know, because we know that when you have prostate cancer, if you have more advanced cancer, you can get what we call lymphedema. You can also get swelling in your ankles if your kidney function isn't as good. So again, we would expect that you would ring us and let us know on the numbers that you've got. Bone pain is something else that could occur. Again, it is more likely to be if you have more advanced prostate cancer, and we know that there is something going on. So you should contact us because we need to decide whether or not we may need to organise any scans for you, or whether we need to get on top of that pain for you with any analgesia. So that's things like paracetamol and ibuprofen and those sort of things that you may normally take. We may need to have a change for those medications for you and get you something different. Other symptoms that you should be shouting help for are if you start to feel breathless, if you're feeling constantly tired. Now, the tiredness could be related to a number of things, and it may not even be related to your prostate cancer. But if it's a change for you, then you should let us know that that is the case. If you suddenly start to lose a lot of weight, and that's more than 3 kilograms, then we would need to know about the weight loss changes so that we could deal with that. If you lose your appetite also suddenly, with or without the loss of weight, we need to know that the weight has gone, and we need to know when the loss of appetite started so we can signpost you in the right direction, because it may not be related to your prostate cancer, and it may be something that we will advise you to go and discuss with your GP. If you're getting any pain when you pass urine, it may be within the bladder, it may be towards the end of the penis, you may feel that it burns when you pass in water, it could be that you've got an element of cystitis and you have a urinary tract infection. And again, if you make contact with us, we will tell you how to manage that symptom. Sometimes, particularly for patients who have had radiotherapy treatment, you get problems with either the bladder or the bowel and controlling any symptoms there. So again, it's something that we would suggest that you make contact with us for. And again, as in the hematuria, you can sometimes find that you pass a little bit of blood from the back passage. So we would need to know about that for you. Can I have them? Thank you. The symptoms that we feel you should let us know about will be on the treatment summary that you should have received. So the letter that comes out before you start going on to remote monitoring will have these symptoms written in, and it will also be in the leaflet that you were given by the nurse specialist when you passed over onto remote monitoring. It may be that the treatment summary will have come from either your urology consultant or from your oncology consultant. But it should have quite a lot of information that will be useful to you, and quite a lot of information that will be useful for your GP to know about the treatment that you have had and about any future plans, and also who to make contact with if you need to do so. During the time that you have been under the care of the clinical nurse specialist in the stable prostate cancer clinic, and prior to that, you may well have filled in a form called a holistic needs assessment. It's a form that we use for patients with all sorts of cancers, but in the stable setting, we do the holistic needs assessment just to find out where you are with your symptoms and what things are worrisome to you and what things you would like to talk about. If you still have your form at home, then again, if you feel that anything changes or there is anything on there that you are worried about in the future, we can always redo that holistic needs assessment for you going forwards, but it won't be something that we will routinely do once you're on remote monitoring unless you let us know that you have a problem. The health and wellbeing information on the screen now, you can see the web link for the Northampton Cancer Guide.co.uk. This is a local Northamptonshire only cancer guide. It gives you links into local and national support services and resources. On there as well, you will find that there are some videos and webinars that contain information and support that have been done for you by the healthcare professionals, and it will tell you how to get onto these. So you need to register to get on. The library here is showing at the moment. Again, it has the link at the top of this. You can select the webinar that you want to connect onto by clicking on the links once you're on. We have set up these things for things that when we did the wellbeing sessions for anybody that previously in the stable clinic attended the sessions at Moulton, which were done jointly with Kettering and Northampton. Caroline, Janine and I did those sessions, but we haven't done them recently due to COVID. So we've put these onto webinars for you with hopefully the information you need. There is a session on continence and prostate cancer, which is done by Alice, who is Alice Knight, our prostate cancer CNS, who has just joined us. There is a session on the prostate service and also the metastatic prostate cancer service. There's also a video webinar on the erectile dysfunction and prostate cancer and treatment options. One on managing fatigue, so suggestions there as to what to do. One on bowel problems and how to manage things. We've done one for hot flushes, which is particularly relevant to any of you that are on hormonal treatment. It's suggestions, some of which we are almost certainly likely to have told you over the years, and some of them which you will have forgotten. There's a session on sleep hygiene, which was originally something that was done by one of the occupational therapists for us, and we've put together some suggestions as to how to help to get you off to sleep. And then there is another session called Move More, which is about physical exercise and movement for you. Physical activity, there is also another link here to the northamptonshiresport.org/cancer. This is a specific program for patients who have got cancer, and it is a 16-week program. It's delivered by somebody who's fully qualified in rehabilitation for patients who have had cancer. So these are healthcare professionals who are doing the sessions, and it is tailored specifically to the needs of the individual. So it's not a job lot, it depends on what you need and where your cancer is as to what you need to be able to do and what your ability is. So if you are restricted for reasons other than your prostate cancer, again, we will tailor it for you. There are also now some free yoga sessions in both Kettering and in Northampton that have been organised. The Northampton ones, I know that some of the patients from the prostate support group over here have gone along to the sessions and found them very good. So that is another way of accessing physical activity for you. The thing to be said really is once you are put onto remote monitoring, we have not forgotten about you. You're not on your own at all. If you have a problem, please do not feel because we've told you you are on remote monitoring that you cannot ring us up. We'd much rather that you rang us than you sat at home chewing off your fingernails up to the elbows and worrying yourself silly when you could be in touch. So Caroline and Maggie and the other nurses are available over in Kettering for patients if you have any issues. Alice and I, and also Donna, who has just joined us, who's a metastatic nurse, are available over in Northampton if there is anything that you want to ask. The difference between self-management surveillance and the routine hospital appointments is it is up to you. So you are in control of managing your own prostate cancer going forwards. And provided your PSA blood test is staying below the threshold that we will have told you we would like your PSA to be at or below, we're not going to bother you. So until you've had your PSA blood test taken, you won't hear from us, and then you'll have a letter. So if you are worried, contact us. If you haven't heard about the results of your blood test, it could be that unfortunately you've slipped off the net or the letter's disappeared en route to you. And if we need to do anything else, further investigations, you will hear from us. That's all I've got to tell you really about the remote monitoring. Thank you very much for watching. Places that you can get other information from if you want to is I am currently sitting in Northampton's information centre. She says scanning around showing you where I'm sitting. The information centre at Northampton, the telephone number is on the screen. They have a drop-in service. If you want to drop in to speak to anybody, they are here, or you can always ring them on 01604 544 211. Or the Kettering telephone number, which is 0781 33 63 539. So there is written information within the centres. In Northampton, we also have the Macmillan, I've lost the word that I'm looking for, but benefits advisor, who I believe also goes over to Kettering and will see you over there as well if you have any problems. So the information centres are open from 9 o'clock till 4 o'clock from Monday to Friday, except at bank holidays. Macmillan Cancer Support is also available on the telephone, and they are open from 8 AM to 8 PM, 7 days a week, with the number being 0808 808 0000. Information is also available apart from the websites which are below with the Northampton Cancer Guide and macmillan.org at Prostate Cancer UK. And again, the nurses there are available from 8, I believe, till 8, and are very helpful with any information you want and any written information you want. I'm now going to throw it open for any questions. Adele, who is hiding in the background, is going to divvy out some of the questions. We're going to answer some of the questions that you have already asked us, that you sent in electronically, and we will split those between the nurse specialists who are here.
Thank you, Pam. Okay, so please don't forget, if you have got questions, to use the function and put your questions to us. We've got some come through. So the first one is there anything that can be done for excess wind? And Alice, is that something that you could answer?
So things like peppermint might help, either peppermint teas, and exercise will help with excessive wind, just to try and shift it.
Okay, thank you. Okay, Caroline, I'm going to come to you next. So my partner has been getting bad backache, and I wanted to know if this could be related to the prostate cancer.
Sometimes this can relate to prostate cancer, usually not. If the PSA is behaving, it's not likely. I would always say, if you're concerned, get it checked out. Is it something that is ongoing? Is it relieved by simple painkillers such as paracetamol? First protocol would be get your PSA done, see the GP, just to check you haven't pulled a muscle or anything like that, and we would then investigate further if it wasn't relieved.
Okay, thank you. Okay. So Pam, I come to you next. Is more frequent urination normal?
It really depends on where you are following your treatment, and everybody is very different with bladder symptoms. So it may be that you have had urinary frequency ever since you had your treatment done, but it could be, if it started suddenly, that it is something related to either a urinary tract infection or even what you are drinking. So think about what you drink during the course of the day. If you are a gentleman who drinks a lot of tea or coffee, even with the decaffeinated drinks, we know that the caffeine in your drinks, in Coke and other things, is likely to give you some bladder irritation and may make you go a bit more frequently. But if it's something that is new, then again, always contact us. We can get a urine sample checked out for you, or you can drop it down to the surgery and get it checked out there, just to make sure that it isn't an infection, and that hopefully would help to settle down your urinary frequency.
Will my monitoring be done by this method from now on, i.e. not by 6 monthly phone calls as before?
Right, if we've told you that we're putting you onto remote monitoring, then yes, we will monitor your PSA every 6 months. What happens is, once we've discussed this with you, part of the Somerset Cancer Database is very specifically remote monitoring. What happens is we put the information in for you. It goes in with a threshold that we would like your PSA to stay below. So normally, if you have had a radical prostatectomy, so the prostate gland has been removed completely, we want your PSA to stay below the level of 0.2. If you have had radiotherapy treatment, normally we would expect your PSA in the first instance to be below the level of 2.0, and that information is fed into the remote monitoring module on the cancer database by us, and we also tell it when we want to follow you up. So as I said earlier, if we spoke to you today, your follow-up next time will be for April and for October, and there will be no phone calls. There will be no reminder to have your PSA blood test done. It is up to you to remember to put it in a safe place, stick it on the cupboard, put it on your calendar, nail it to your forehead. That's the best way of remembering how to get it done. So yeah, remote monitoring from now on, unless there's an issue, and then we will be on the phone to you.
Thank you, Pam. Alice, if I come to you next, it's been 5 years since I was diagnosed and treated. Am I cured, or could the same cancer reappear?
After your treatment has finished, then we call you stable prostate, and what this means is that your prostate cancer is managed, it's stable, but there is that chance that it may reappear, which is why we monitor you every 6 months to ensure that if it does, your PSAs do start to rise again, then we can add treatment as necessary and refer you to the appropriate urology.
I have some urine leakage, which is getting worse, and so some urinary, sorry, I can't seem to say this word, urinary burning when I pass urine. Is there any reason for this, and what can be done to help?
Right, this definitely sounds like there may be a little bit of infection there, especially if you've got some burning and frequency, bit of leakage. I would say first instance, make sure you give us a ring. We can send you out a pot and a form to get that tested. It takes 3 days to get the test done for the bugs to grow, if there are any. In the meantime, you can drink plenty of the good fluids, avoiding tea, coffee, alcohol, fizzy drinks, but plenty of fruit juices, squash, milk, anything like that, to try and help flush everything out, because diluted urine comes out a lot easier than concentrated urine and won't sting as much. Once we've done that, we can check whether there is infection and treat appropriately.
Great, thank you. We may have already answered this one, but it's probably good to recap. So Pam, what is the acceptable PSA points range?
The PSA really depends on where you are with your treatment, because we have patients on remote monitoring who have never had any treatment. You have been put on to what we call watchful waiting or deferred hormones. So depending on your age group will depend on what we want your PSA blood test to go up to. And as long as you have no symptoms, we might, if you are in your 80s, say that your PSA could go up as high as 20 before we are anxious about you. If you are on hormonal treatment at the moment, so you have your Decapeptyl, Prostate or Zoladex injections every 3 months, or even with Decapeptyl every 6 months, then we will have got an idea as to where we will allow that PSA to go up to before we start treatment. So we know really what we're looking for with that, but there isn't necessarily a figure that we've said to you, but probably ideally we'd like it below 10 before we put you onto any treatment, but it depends on the individual. If your prostate gland is not there and you have only had the prostatectomy, then ideally we want your PSA less than 0.2. Once it goes up to 0.2, then you would be contacted by us with a view to whether or not you need to have some additional treatment. And again, we would probably have told you that that was the case before we started your remote monitoring. If you have had either radiotherapy or brachytherapy, the figure that we will look at in the first place is 2.0. But we might let that go up higher than that, provided you don't have any symptoms. We would let it go up to 6 or 10, but probably we will have discussed you with the oncologist to see what they want us to do. And again, it depends on other things that are going on with your medical history, because if you have a lot of cardiac problems, we're not going to want to rush in and put you onto treatment if we don't have to. So it's very much an individual thing, but hopefully on your letter, when we go on to remote monitoring, we will have told you what the figure is. It will say PSA threshold, and that's the level that we want your PSA to stay at.
Great, thank you, Pam. So Alice, I'll come to you next. Does alcohol intake affect prostate health?
It doesn't affect the prostate health itself. However, we always say about drinking in moderation, following the government guidance, and also alcohol will irritate your bladder. So it may be that you go more frequently and you might be up a few times during the night. So it's about moderation, but it doesn't affect the actual prostate itself.
Okay, thank you. So Caroline, another question that's just come in is, I have the blood test application form. Do I just bring it to the blood testing department or apply through my doctor?
Okay. Wherever you would normally go for your blood test is absolutely fine. I know at the moment there's been a few problems with the blood bottles, so we've got a designated number to call for urgent blood tests, but normally it would be just ring where you would normally book to have your blood test done, get that done, and we will get the results.
Thank you.
I think the other thing to say there just at the moment is, where in the past, for any of you that used to just drop into the bloodletting unit, whether it is at Isbrook or Northampton, since COVID struck, it is an appointment only. You cannot turn up at the laboratory and expect to have your blood test taken. You need to book first. And the telephone numbers should be on the back of your blood form. And also, if you're in Northampton, you can do it electronically. You can go via Swift Queue to book your PSA blood tests. And now that they have got bottles back, we have lost the bit that says we'll only do your PSAs and tests if it's urgent. So you should be able to book your appointment.
Great, thank you. So the next one is for you, Pam. How do I contact the CNS team?
Right, there are a number of ways that you can make contact. Anybody that came into the Stable Prostate Cancer Clinic will have had contact details in the first place by means of my card. So the telephone number for me on there is 01604 52 3108. It will be on the self-supported management leaflet that you've got. It will be on the letters that you've got. It says direct line at the top. Do not be terrified if you come through and you hit the triage system. That's just to make sure that we deal with the calls that we need to deal with. And you need to press option 4 and option 2. And also on the card, if you want to make contact with me via my mobile, I can never remember the telephone number, but it is on the information that comes out to you if you want to make contact with me that way. And also you can email me at pam.ferrer@nhs.net. I endeavour to get back to anybody that emails me. I know I've got a couple of outstanding ones at the moment. So there are a number of ways that you can do that. For the nurse specialists over at Kettering, again, I know that they will have put their contact details onto any cards that you have got, any letters that you come out to you, you should have their contact details in the same way. Alice, the same. Alice has cards. Everybody gets our cards now. We have this wonderful little sticker for which we have just won an award for making it easier for patients to contact us. And Alice sends that out, stuck in the front of every pack that goes to every new patient, and it comes out to everybody when they come in onto Stable Prostate Cancer as well. So we're quite easy to get hold of. Don't give up. If you come through on an answer machine, please leave us a message. So give us your full name, your date of birth and your telephone number, and we will always come back to you.
Who will be looking at and monitoring the results from remote monitoring?
Okay, so here at Northampton we have a support worker called Julie who monitors the PSAs on a weekly basis to make sure that they have been done and to look at the results. If she's not sure of the results and they've either gone up or they've changed significantly, then she'll either let me or Pam know the results. We also check it on a regular basis to make sure that everybody's PSA levels are done and are within the normal limits that we've set for them. And I'm sure it's the same at Kettering, where they have a trained nurse looking at the results on a regular basis as well.
Great, thank you, Alice. So Caroline, we've had a question saying, can I access my information via an app?
We haven't got an app at the moment, maybe in the future, but at present there isn't an app available.
I think the thing also to say there is that although there isn't an app at the present time, the plan with the Somerset Cancer Database was that eventually you should be able to get access to your own information on there. It isn't happening yet. Watch this space. We hope at some point in the future that we will be able to put sort of email contact things on there where you will have your own login, but we haven't got there yet.
Thank you. So Caroline, we'll come back to you again. How long will I be monitored for?
No, you can't get rid of us. Once you've got us nurses, you've got us, we will be monitoring you in one form or another for the rest of your days, whether that be finally referring you back to the GP or not, but you will always be monitored with your PSA.
Alice, if I come to you, what happens if the PSA has gone up?
What we'll do is we will phone you to ensure that you haven't got any urinary symptoms or any other cause for a raise, and then we'll get you to repeat your PSA again just to make sure that we've got the correct levels. If it continues to rise, then we'll refer you back to the urology team for review of treatments to see whether we need to do anything about it. And then we'll wait for their response.
Thank you, Alice. So Pam, this question's come in. I usually take Viagra, but it's not having the same effect. What would you advise I do?
Well, if you've been taking Viagra for some time, we need to know the dose of the Viagra that you take. Viagra, or its proper name now is sildenafil, is a tablet that comes in 3 different strengths. If you are on the lowest strength, the 25 milligrams, provided you are not getting any adverse effects from it, then you could go back to your GP and just ask your GP if he will increase that dose for you up to 50 milligrams. If you're already on 50 milligrams, we can again increase you up to 100 milligrams. And if you're already on the 100 milligrams and that ceases to work, then you need to be talking to us to find out where to go to next, which may be to have a further discussion in the erectile dysfunction clinic, one of which it happens in Northampton. That's operated by Sally Mora, who is the urology clinical nurse specialist. I think that Val still does the erectile function clinic over in Kettering. And again, so if we need to refer you in there to discuss other treatments, if your tablets are not working, there are other things still out there that we could go to for you, provided you have a proper discussion with somebody about it.
Thank you, Pam. So Caroline, I'm going to come to you next. I'm passing blood in my urine. What should I do?
Again, this could be a sign of infection, so it's important that we get that checked out. Even if you just see it once, it's still important to get it checked out. It may be related to side effects of radiotherapy or surgery if it's soon after. It may be infection, it may be something else. So it's always something we need to know about. Our initial thing would be to do a wee test, check there was no infection and go from there.
Thank you, Caroline. Alice, this is one for you. I haven't had my bowels open for 2 days. Who should I speak to, the CNS or the GP?
You can speak to us. It's probably slightly easier than trying to get hold of a GP at present, and we can advise you with some simple laxatives. And if you need anything stronger or your bowels are still not open, then we'd always advise you to go back to your GP because it may be something else that's going on.
My vacuum device has broken. What should I do? Who should I contact?
Most of the patients coming through now, if you've had a prostatectomy, whether you're in Northampton or in Kettering, are likely to have a vacuum pump that has come to you through the erectile dysfunction clinics, so from the hospital, and it will have been manufactured by a company called iMedicare. So when you had that pump, you would have had a discussion with the rep. They will have got the pump that is the right size, for you. If you are within 5 years from having had that pump, they have always had a guarantee on them for 5 years. So you could contact the company directly to ask about, getting a replacement part, because it very much depends on which bit of your pump has broken. If you've snapped the handle off the pump bit, then it obviously isn't going to work and we need a new bit. If it's the cylinder itself that is cracked because you've decided to drop it in boiling water or something, or you've dropped it on a hard floor, then you may need a new cylinder replacing. So your best bet is normally to go back to iMedicare if that is who your pump has come from. We do have pumps from other medical companies. If it is a pump that you have bought yourself, I'm afraid that you're on your own, but you could always speak to us to see if we can get you a proper pump through the hospital. So there's multiple companies that do them, but we tend to suggest that you have a pump that is a proper medically approved one, because then we know that you're getting the right size and we know that you've been taught what to do with it.
Thank you, Pam. So Alice, this is a question that's just come in. I know we can't answer individual questions, but this is saying, do you send a copy of letters you send out to my doctor, as they've only received one letter and that was about 18 months ago?
We always send out letters to you after, when we've got the results, to let you know what your results were and when your next test is due. If you don't receive a letter within a timely manner and you're concerned, then you can contact us, the CNS, either at Kettering or at Northampton, and we'll get one out to you.
Are my details going to be safe, and who has access to the information on remote monitoring?
Right. The access will be exactly the same as when you are monitored by a telephone call or an appointment. There will be no more people having access to your details, so it will be the CNSs, the support staff, the secretary, the consultant. It will be everyone who would normally have legitimate access to your records and notes will still have that access. Nobody extra will have that access.
What happens if I move away from the hospital?
Initially, with patients on stable disease, I did speak to patients still in Skegness and various other places. It does make it much more difficult to manage patients when you are a distance away for getting access to your PSA. So generally, if you move away from Northamptonshire, then we would expect you to have your follow-up done in the locality that you move to. So one of my patients who's moved down to Swindon, I did a letter to the GP in Swindon where he was moving to ask him to arrange the follow-up there. So provided you have a nice little folder with all your letters over the years that says about what your prostate cancer is, then we would suggest that you continue to get your PSA blood test done through the GP where you are going to once you're registered. They will ask for your notes to follow you down to wherever you're going to, and any letters And then your follow-up should continue in just the same way wherever you are nationwide. There are an awful lot of clinical nurse specialists doing follow-ups. Sometimes it's done by the GP, but remote monitoring is happening from Truro to goodness only knows where up north. It is generally operated by the nurse specialist from the hospital, and then they will discharge you back to the GP when they think it's the right time and you are sufficiently stable. So make contact with your GP if you move.
Thanks, Pam. Alice, I've got a question just come in. I want to go abroad, but how do I know if I still have prostate cancer? I'm worried about travel insurance. Who should I go to for this?
So we could never say completely that you're cured from your cancer because we put you onto remote monitoring. What we can say is you have stable cancer. There are various companies that deal with insurance, and the best places to find this information is either the Macmillan website, the Prostate Cancer website, which is a local charity, have information about insurance companies, or the information centre at either Kettering or Northampton will be able to help you where to go for travel insurance. So unfortunately we can't say that you've ever been cured from cancer. We can only say that you're stable and to contact the various places for advice.
Thanks, Alice. So Caroline, where do I get the PSA request form from?
We will send you that form. When we send you your results, you will get a new form in the post, and you keep that safe, ready for the next time you need it. Should you lose it, should the cat eat it, should you forget and you write your shopping list on it, give us a ring, we can send you out another one, but you will be given one. Each time we send you the results out, you'll be sent another form ready for the next time.
Thank you. Okay, we're coming up to 3 o'clock, so we'll make this one the last question, and I'm going to come to you, Pam. What happens if I forget to have the PSA checked?
Because on the remote monitoring system we have varying different colours. When your PSA is done and it is up to date, it shows green when we put you on. When your PSA blood test is due, you go amber. So that will come up a week or so before your PSA is due to be done. But when your PSA hasn't been done, you will go red. So we know that those are the ones that we're looking for. And Julie in Northampton, and I think Maggie over in Kettering probably look at the PSA results every week, and then the letters will come out. If you go about 2 weeks after the date when we think you should have had your PSA blood test done, then we will send you a lovely little letter that basically says, here, where's your PSA blood test? And we send you another form and ask you if you can get it done as soon as possible. And then again, you'll get a letter with your result once it's been done. If we have a couple of sessions where your PSA still hasn't been done after you've had the letter, then you are likely to get a phone call from a stroppy nurse specialist to find out what's going on and why you haven't had it done. Now, we appreciate at the moment, because there has been the shortage of the blood bottles, that it hasn't been possible to get your PSA done. So we've given people a little bit of leeway and haven't necessarily sent the letters out. And also some of the surgeries have been saying, no, we can't do your PSA at the moment. The bottle shortage seems to be resolving itself at present. So if you haven't had it done and you have had a letter, try and book it. But if there is an issue, ring us and let us know that you've missed it or you've forgotten. But otherwise, you should have had a letter from us with a new blood form to say, why haven't you had it done?
That's great, Pam. So I don't know if you've got anything else you want to add to round up.
I think for everybody out there, if anybody is sort of bothered about being on remote monitoring, we are definitely keeping an eye on where you are. The guidance comes out at the moment, the guidance from the ECAG, so that's the East Midlands Cancer Group, is looking at whether we keep you forever. Hitherto, we know that we ideally want you to have your PSA blood test done every 6 months, certainly for so long, and then certainly annually after that. There is a possibility that going forward that you may find that we will discharge you back to the GP, but we're trying to decide on how we do this because we need to make sure that you are safe. And with having you on remote monitoring, we know that you are fairly safe, that somebody is keeping an eye on you. So please do not feel that you are on your own. We are still here. We're not going anywhere yet a while, although I'm sure that they'd like to retire me off fairly soon. I am likely to be around for a little while to come. Alice is definitely going to be around for a lot longer because she's younger than me, as is Caroline. And so somebody is always going to be there if you have any concerns. So thank you very much for joining us. Thank you to Alice, Caroline and Maggie for coming along. And thank you very much to Adele and Laura for doing the information technology because we're rubbish at it. Thank you very much. Take care. Speak to you all soon. Bye-bye.